Good day guys, welcome back to Wicked Science YouTube channel. In this video we're talking about scalp, and the anatomy will cover the concept of the scalp, the boundary, the composition, the innervation, the arterial supply, the venous drainage, the lymphatic drainage. We have the clinical advantages, we have the applied aspects, and if time permits, we'll talk about the revision exercise. Let's get started. What is scalp? Scalp is a collection of several tissues that covers the calvaria of the skull. When you hear the word calvaria, calvaria simply means an aspect of the skull. Now, the skull is having three aspects. We have what we refer to as the calvaria. We have the facial skeleton, and we have the mandible. It is necessary to know in the course of this video that the collection of the calvaria and the facial skeleton is what is referred to as cranium. So we already know that the calvaria is a component of the skull. So now let's look at the boundaries of the scalp. We have the boundary in four different ways: the anterior boundary, the lateral boundary, and the posterior boundary. The anterior boundary makes the highbrow or the superior orbital margin. The lateral boundary, it covers the superior temporal line above the temporal fossa, and you have the posterior boundary to be around the external occipital protuberance and the superior nuchal line. This make up the boundary of the scalp. Let's get to the composition of the scalp. What make up the scalp? The scalp can easily be remembered in its composition according to the name scalp. So therefore, it means that when you hear the word scalp, you already know the composition of the scalp. What are this composition? We have S, C, A, L, P. What is S? That is the skin. You also have C to be connective tissue. A is aponeurosis and muscular part. You also have the loose areolar connective tissue. Therefore, it is necessary to know that if this is loose connective tissue, this will be a dense connective tissue. While here we have this to be pericranium. When you talk about the skin, that is the outermost covering of the body. Here we have the hair, we have the glands, that is the sweat gland, the sebaceous gland, and the lights that we have in the regions of the skin. When you talk about the connective tissue, that's the dense part. In this dense connective tissue, that is where you have the blood supply, that is the arteries, the veins, and the innervation. They are found in the region of the connective tissue. Here, the arterial walls are attached closely with the tissue to prevent displacement of these vessels. The aponeurosis that we have here is called Galea aponeurotica. What is an aponeurosis? Aponeurosis is a flat sheet extension of a muscle. So you must note that when you talk about the aponeurosis compared to tendon, Tendons are usually strands, continuation of muscles. But when you talk about aponeurosis, they are flat sheets, continuation of muscles. So the sheet that we have here is called the Galea aponeurotica, and it bounds the region of the scalp. Now let's see. If this is the highball, you have the supraorbital. Here will be the supraorbital. This region will be our supraorbital, and it extends over the what? The superior temporal line, and it continues to the where? It continues, therefore, it extends above the supratemporal line, and it continues to the external occipital protuberance. These make up the aponeurosis. It is important to note that the skin, the connective tissue, and the aponeurosis, they are strictly attached together to make up a single unit or a band, to make up a band. So here we have the outermost to be the skin. The outermost is said to be the skin, and after the skin we have the connective tissue. After the connective tissue, we have the aponeurosis. These three are taken as a single unit. They are attached together as a single unit. And then we move to the what? Fourth layer. The fourth layer of the scalp is called the loose areolar connective tissue. The loose areolar, so this is it. The loose areolar connective tissue. Areolar connective. This layer called loose areolar connective tissue is also known as the dangerous area. It is also known as dangerous area of the scalp. The reason it is called this, we will get to understand better in the course of this video. When we talk about the pericranium is a sleeve of fiber that is attached to the cranial bone. That is why it's called a pericranium. Do not forget that in osteology of the bones, we have a sleeve around the bones which we refer as periosteum. So in this case, the bone specifically referred to here is the cranium. That is why it's called the pericranium. This sleeve is also present inside, that is beneath the skull. When it is found beneath the skull, it is called endoostia. It is called the endoostia. So now, this makes up the 5 components of the scalp. What then are the... So here, the 5th component here is called the pericranium. The 5th component here is called the pericranium, which attach closely with the scalp. Let's move to the aspect of the innervation. The scalp is divided into 2 regions or aspects, or we call them quadrants. These 2 quadrants is separated by an imaginary line that runs from the right here to the left here. Now see, let this marking be the region of the hair. When we trace this up, it will separate the scalp into the front, which is the anterior, and the posterior. So from here to this region, that is an imaginary line that separates these two, anterior and the posterior. Here we also have something like this that separates this portion into anterior and posterior. This region also we have anterior and the posterior region of the scalp. The posterior region of the scalp. So there are 10 nerves that innervate the what? That innervate the scalp. 5 anterior and we have 5 posterior. The anterior region starts with what we refer to as supraorbital nerve. We have the supraorbital nerve. And where do we have the supraorbital nerve? It passes through this region called supraorbital notch to supply the front part of the scalp. We also have the supratrochlear nerve. The supratrochlear nerve also passes through the margin of orbit to supply the anterior region. So now this represents our supratrochlear nerve, and this on the other way represents our supraorbital nerve. The third type of nerve we'll be talking about here is we also have a nerve that pierces this region between the zygomatic. Don't forget, this region will be our zygomatic. Between the zygomatic and the temporal. Pierces the region between the zygomatic and temporal. So we'll call it zygomaticotemporal nerve. Zygomaticotemporal nerve. This nerve arises from this region. It arises from this region and supplies the lateral side of the scalp. It supplies the lateral side of the scalp. With respect to this, we also have another nerve that arises from the region of the ear, which we call the auricular, and it goes from the region of the ear called the auricular, and it goes over the temporal. It goes over the temporal. This particular nerve is called Auriculotemporal. It's called Auriculotemporal. Auriculotemporal nerve. Now, these are the 4 nerves. All these 4 nerves are branches of trigeminal nerve, which is a cranial nerve. It's a cranial nerve. That's the 5th cranial nerve. The trigeminal nerve as a whole is sensory. So it means that the supraorbital nerve will be carrying sensory impulse. The supratrochlear nerve is carrying sensory innervation. The zygomaticotemporal nerve will be carrying sensory innervation. The auriculotemporal nerve is also carrying a sensory innervation. They are all branches of the trigeminal nerve. But you must know that the trigeminal nerve is having 3 main or major branches. What are the 3 major branches? We have the ophthalmic, we have the maxillary, and we have the mandibular. The ophthalmic is specific to supraorbital and the supratrochlear. So we say that the supraorbital and supratrochlear, they are branches of ophthalmic nerve. The zygomaticotemporal is a branch of the maxillary nerve, while the auriculotemporal is a branch of the mandibular nerve. All of these 3 nerves are now called You can see there are three, so we call them trigeminal nerve. They are called trigeminal nerve. But don't forget that we said the anterior portion is actually supplied by 5 nerves. What is the fifth nerve? The fifth nerve is called temporal branch of facial nerve. It's called the temporal branch of facial nerve. The temporal branch of facial nerve. Now get something here. So we're making 1, 2, 3, 4, 5. 5 nerves. All of these are sensory. Why this alone is what? Is motor. What do we mean by motor? It means that it supplies muscle. Now, this region that we have, the layers of the scalp, consists of 5 regions. The skin, the connective tissue, the aponeurosis. The region of aponeurosis will also have a muscle. Don't forget I said aponeurotic is an extension of muscle. The muscle here is called the occipital. It's called the occipitofrontal muscle or occipitofrontalis. Occipit, meaning that from the occipital region or occipital bone to the region of the what? Frontal bone. This occipitofrontalis muscle is having connection with the posterior marking. And the posterior marking, do not forget, I said is what? Superior nuchal line. So it's having origin from the superior nuchal line and extend forward to the frontal region and attach to the what? To the muscles in the front part of the skull. So we call the frontal muscles. The attachment origin comes from the superior nuchal line to the muscles in the frontal region. So this nerve innervates this muscle, and that is what is responsible for the wrinkling of the forehead. When you want to give a kind of reaction like this, you realize that the forehead is wrinkled. The wrinkling of this forehead is as a result of the muscle called occipitofrontal muscle, and it is also responsible for the raising of the eyebrows. If you want to raise the eyebrows, it is also responsible for the raising of the eyebrows. This covers the aspect of the anterior region of the scalp. It covers the anterior region of the scalp. Do not forget, we also have posterior region. So let's quickly go through the posterior region. Let's go to the posterior region. In the posterior region, we also have 5 types of nerves. The first type of nerve I'm going to talk about here is the one that arises from the auricle region of the ear. And what do we call it? We call it the great auricular nerve. It's called the great auricular nerve. It's called the great auricular nerve. It's called the great auricular nerve. Now, this is it. For quick remembering, remember that the posterior region is supplied by 3 occipital nerves. 3 occipital nerves. Remember that they are supplied by 3 occipital nerves. The first one is called the greater occipital nerve. The second one will be what? If you have greater, what do you have? Lesser occipital nerve. Lesser occipital nerve. And the third one will be called what? Since we have this to be greater and this is lesser, we can simply call it the third occipital nerve. Third occipital nerve. Now, all of these nerves that we have here, they are nerves that arise from the cervical plexus. The greater auricular nerve emerges from the foramen between the first and the second vertebra and passes through the foramen ovale, and it supplies the auricular region towards the what? Posterior region of it. And it does this by supplying towards the apex. It supplies towards the apex of the scalp and also some regions of the neck downward. Now when we talk about greater occipital nerve, the greater occipital nerve also supply the posterior region. The reason this is called the greater occipital is because one is greater and the other is what? Lesser. So it means that they both emerge from a particular nerve, and in which one division will be greater and the other is what? Lesser. So this one is the greater occipital and this one is what? Lesser. What is that nerve which they emerge from? That is what? Is the second cervical nerve. Why this great auricular emerge from what? The second and what? Third. You can see the reason why this one is called the greater. Great auricular nerve is called great auricular nerve because it's having the larger innervation in the region of the scalp. Why this one is called the greater? Because the other branch of it will be what? Taking a smaller division. So we call it the lesser occipital nerve. They both arise from the second cervical. The third occipital nerve is also a branch of the what? Of the cervical plexus. Okay, we've mentioned 4 nerves here. Then we are left with one. What's that one? They will call it the what? We call it the occipital branch. The occipital branch of facial nerve. Occipital branch of facial nerve. Why is it called the occipital branch? Because it's found in the occipital region. Now take note of it that the facial nerve is responsible for the innervation, motor innervation. Is responsible for motor innervation of the scalp. The motor innervation of the scalp in the posterior region will be by occipital branch of the facial nerve, and on the anterior to the lateral side is by the what? The temporal branch of the same facial nerve. So the facial nerve that you have here serves the motor function of the innervation. These are the 10 innervation of the scalp. Now let's move to the arterial supply and venous drainage. Quickly, we cover this in a single fold by saying that we have about 5 arterial supply. We have 5 arterial supply and 5 venous drainage. So this is the arterial supply, venous drainage. The first is called the Supratrochlear artery, and we also have the Supraorbital artery. These are the 2 arteries in the frontal region. So when we're talking about the veins, the same thing is applied. Don't forget we have 3 here, we also have 3 here. The same thing is applied. We have the Supratrochlear, and we also have what? You have the Supraorbital. These are the 2 in the front region. Then from the side, we also have an artery that runs over the surface of the temporal muscle. What do we call this? We call it superficial temporal artery. The superficial temporal artery. So this is the 3rd one. Here we also have the 3rd one called the superficial temporal vein. Don't forget, this aspect is for vein, this aspect is for vein, and this is for artery. So here we've completed the 3 in the anterior, 3 in the anterior. Don't forget that we have how many altogether? 5. We have 5. So here, remaining 2. The 2 on the posterior region now is called the what? The posterior auricular artery. The posterior auricular artery, meaning that it appears behind the ear, because this region of the ear is called the auricle. So we have the posterior auricular artery, and here what do you have? Posterior auricular what? Auricular vein. posterior auricular vein. Then the last one is called the occipital artery. Occipital artery. So here we have the occipital artery. What is the occipital artery? In the occipital region. So we also have the occipital vein. So occipital vein. The big difference between the atrial supply and venous drainage is that there is a foramen in the skull or calvaria which connects the artery and the internal parts together. This is called the emissary foramen. So we have this foramen for emissary veins. So what are emissary veins? They link the outer part of the skull to the internal part of the skull. So this is the atrial supply and the venous drainage. Let's move to the aspect of the lymphatic system. To the lymphatic drainage, there are three lymph nodes that which we talk about here. There are three lymph nodes we talk about. There are three lymph nodes. The first one is called the one you have in front of the auricle. We call it pre-auricular lymph node. Where does the pre-auricular lymph node supply? It drains the region in the anterior portion. The anterior portion is drained by the pre-auricular lymph node. I want you to also know another name for it. In the auricular region, there is a gland here. What do you call it? Carotid. So it can also be called the superficial parotid. The superficial parotid what? Lymph node. The second one is the one you have behind. You have this in front and it's called pre. And this one will be called what? Post. So we call it the post-auricular what? Auricular lymph node. Post-auricular lymph node. But when you check this region of the skull, this region you have a bone here. This bone is called what? Mastoid. This region is called mastoid bone. So we call it what? We call it the mastoid lymph node. It's called the mastoid lymph node. Mastoid lymph node. The third one is that you have it in the posterior region. So you call this, the posterior region is drained by the occipital what? Occipital lymph node. We've covered the aspect of the lymphatic drainage. Let's move to the clinical advantage. Number one is that the scalp is sometimes called a safety valve. Why is it called a safety valve? Because it prevents hematoma. Do not forget, when you hear the word hematoma, hematoma simply means in related to blood. So it is called a safety valve hematoma. So a safety valve hematoma of the scalp. What does this mean? Okay. In the subdural space, there can be accumulation of blood. With the help of the emissary veins, which connect the internal part of the skull to the external part of the skull, the blood is drained out to the scalp region. So this is called a safety valve hematoma. It prevents hematoma of blood, accumulation of blood in the subdural space. So that's the clinical advantage. Let's now move to the applied aspect. Okay, in the applied aspect, we have what we refer to as the black eye. What do we mean by black eye? The black eye is significant with the presence of a black spot in the region of the eye, which is usually as a result of the deposit of what? Of blood, bruise, a black bruise that is collected in the frontal region of the scalp around the region of the eye. If this particular damage to the scalp is not easily treated, it can affect the region of the eye. It can affect vision. So we call this black spot that appeared in the region of the eye, we call it the black eye. Let's talk about Cephal Hematoma. What is the meaning of Cephal Hematoma? Cephal Hematoma. I said earlier that whenever you hear the word hematoma, it means related to what? Blood. Cephal Hematoma is the accumulation of blood in a space between the pericranium and the cranial bone. Don't forget I said earlier that the pericranium is fused, like is attached to the cranial bone. But once this blood spill into this region as a result of damage due to injury or accident, then blood can accumulate in this region and it can cause herniation of the layers of the skull, or it can even cause osteoporosis of the skull bone. So this is called a cephal hematoma. It is called cephal hematoma. The third one is called cephal hydrocele. Cephal hydrocele. What is cephal hydrocele? Cephal hydrocele is the accumulation of the cerebrospinal fluid, CSF, in the region between the endosteal and the cranial bone. Don't forget I said earlier that the endosteal layer is found inside the cranium, while the periosteal layer is found outside the cranium. So in the region between the endosteal layer and the cranial bone, if there is accumulation of CSF in this region, it is called cephal hydrocele. Now, I want you to get this clear. Cephal hematoma is quite different from caput succedaneum. Caput succedaneum is a swelling that arises in the region of the scalp of a newborn baby as a result of the restriction to the flow of cerebrospinal fluid. So you always have a restriction to the flow of blood. It causes caput succedaneum. This swelling usually disappears within 24 hours. So if it does not disappear within 24 hours, it is significantly a what? Cephal hematoma. Now the last aspect is called the dangerous area. Dangerous area of the scalp, as I said earlier, don't forget we have how many layers? 5. The first is the skin, the connective tissue is the second, the third is what? The aponeurosis, the fourth is the what? Loose connective tissue, the fifth is what? Pericranium. Now in the region of loose connective tissue, this region is called the dangerous area. Why? Because this region can be prone to damage. And when this region is prone to damage, infection from the scalp through emissary veins can be directed inside the cranium. It can be carried from outside into the cranium, which will affect the brain and other parts of the skull. Let's come to the end of this video, and we actually look at some revision exercise after this video. Thanks for watching.